you. Thank you very much. I apologize, my voice, it is a bit sore. I'm very grateful to the organizers of this conference and for inviting me. It's a pleasure to come to Iceland for the first time. I'm full of admiration for the way they have organized this. We all know what a problem it is to organize conferences, and often when people are themselves ME sufferers. You've also heard some brilliant scientific presentations. Your minds must be going round like that, like mine is. And I think it's very heartening to know that there's so much research being done in America by Dan Peterson and his group. I've heard people in the UK say, we'll stop doing it, we'll just leave it to the Yanks to get the money. But we now hear that even in England we are making efforts. In East Anglia, we heard from Simon. I'm sure you all realize the fantastic importance of the work from Norway, which we've just heard about. It's incredible that we are now beginning to get some form of treatment for this condition. And I'm not a research worker, I'm just a clinician. I'm a pediatrician with 30 years experience of pediatrics. So mainly for light relief, I'm just going to tell you some stories, some jokes, some horror stories, and you can all relax. It would help me if I knew what the audience consists of. So can I ask how many of you are personally sufferers with ME/CFS? Yeah, you have my sympathy, of course. How many of you are carers or relatives of sufferers with ME/CFS? Okay. How many of you are health professionals? Wow. Any doctors? Very good. That's very helpful. Thank you very much. It's funny that because I have been drawn into acting as an advocate for children with ME, I'm invited to Sweden and Belgium and Holland and Denmark and Norway and Iceland, but I never get invited to lecture in the UK. Just working as a general pediatrician, I first became aware of ME when a young girl came to my clinic in a wheelchair, and I said, gosh, what's wrong with you? She said, I've got ME. I said, oh, I don't know anything about that. Tell me all about it. And she explained to me that she loved going to school, but if she went Monday, Tuesday, Wednesday, she would have to go to bed for a week, and she had to budget her energy. And it was absolutely genuine. And once the word got around that I believed in ME, then I got flooded with patients. And I'm going to talk about a follow-up study I did in my own region, which will give some idea of the natural history of this condition. I must congratulate the Icelandic medical profession, because I hear from the organizers that you have had no cases where families of children with ME have been persecuted and threatened by doctors who did not believe in it. This is not the case in the UK. I've personally been involved in 40 families threatened with the removal of their children because the doctors did not protect them. I have attempted to help a family in Norway unsuccessfully, and I'll also tell you a story about a girl in Germany, and you've all heard about Karina Hansen in Denmark. So Iceland is much better than those other places. So my running total is around about 700 cases. I'm now retired, and I mainly see cases from around the country in which there's a controversy. For instance, last week I was asked to see a case, and the pediatrician said it cannot be ME because ME does not last longer than 6 months. That is a consultant pediatrician in the UK. And they diagnose them as what used to be called Munchausen syndrome by proxy, and is now called factitious and induced illness. Now, we all know Munchausen syndrome by proxy is real, but it is very, very rare. And now we are having one case a month accused of FII, by the doctors and social workers. It's crazy. Just say something about the diagnosis in children. Having heard Dan Peterson and the adult physicians talking about it, I think the situation in children is much cleaner and purer. The differential diagnosis is much simpler, and there are far less other conditions to worry about. The diagnosis is, I always teach that the diagnosis for the doctor should be a positive clinical diagnosis. Yes, I think this is best explained by you having ME. A lot of people say it has to be exclusion, and you have to do millions of tests to exclude it. I'm comforted to say that of all the cases I have diagnosed clinically, which is now getting on for 700, none of them have come back saying you were wrong. This was Addison's disease. This was rheumatoid arthritis. I had one case where the mother pointed out that I was wrong and that her son did not have ME but had narcolepsy, and he kept falling asleep, and she was right and I was wrong. But otherwise, following a good, thorough clinical assessment, you can't go that wrong in childhood. As Dan said earlier, the cardinal symptom is post-exertional worsening, and some of the definitions, like the Oxford definition, do not contain that, and this leads to a spreading and a confusion of chronic fatigue states and depression, and leads to overestimate of the condition in the population. Not only is a history, taking the history very thoroughly, vital for diagnosis, it is vital for the doctor-patient relationship, because the patient feels the doctor believes in them and is asking clever questions that elicits things that they haven't yet complained of. The general approach to management in children, it's similar to adults. The good news is that the prognosis in children is slightly better than in adults. And I'll show you some graphs of 49 of my patients in a follow-up study. We've already heard Dan being rightly skeptical of cognitive behavioral therapy and graded exercise. And we have one little bit of good news in this country, that thanks to the Institute of Medicine report from America, our NICE guidelines, which are the national guidelines, are about to be rewritten, and we hope very much that they will now remove CBT and graded exercise as recommended treatment. I should mention that both CBT and graded exercise come in two varieties, one benign and one not benign. CBT can be helpful, which is kind of common or garden, common sense, where you're helping someone to manage their activity and not to overdo things. That is someone who accepts that they have a genuine illness and that you're just giving good advice. I suppose that's what I did. But there's another form of CBT which is very psychological. It says the fact that you are still ill is because you have abnormal illness beliefs, and we're going to get into your brain and we are going to remove those beliefs. Similarly, graded exercise, if it's truly graded, can be gentle. It can mean doing less. But most of the proponents of graded exercise are the rather forceful approach, and I've seen it in writing from a British paediatrician. You must increase your activities by 10% per week. Now, if I did that, I would be in the Olympics within 6 months. But when the parents complained their daughter was feeling worse, they were told to push through the pain and it would be worth it. That girl has subsequently made 2 suicide attempts. So it isn't much to ask for that a doctor should then say, we'll give you sympathy, we'll give you support. There are lots of practical things for support with children in the educational system, negotiating with the school, giving special allowances for exams and extra time, and above all, protection from the kind of thing I was talking about. And a child with ME who does not have an official diagnosis of ME is at risk of being persecuted. And in our country, the educational system is remarkably pressurized, and they're always fighting to have 100% attendance, and they're objecting to children in their school who are missing school. And symptomatic treatment is just an art in itself. This is the follow-up study I referred to. 49 cases over 8 years, so that was a bit of a cluster. There was certainly a mini epidemic of ME in the late 80s, almost worldwide. These were consecutive cases, and we included some that were quite mild, and they only received supportive therapy. They didn't have CBT, graded exercise or anything, but 6 of my most severe cases I gave immunoglobulin to, and we'll talk about that later. And that's a very rough way in which we broke down the severities for the sake of these rather beautiful colored graphs. Now, of the 49 cases, these were the 15 lucky ones. So 30% made a full recovery in 3 to 6 years. And I think that is better than the adult figures. And of course, none of these had anything harmful done to them. And some of them were moderately severe. On this grading, you have to be about 70% to attend school. So even these ones who recovered missed quite a large amount of school. And studies have shown that this is the condition that causes the largest cumulative schooling loss in our country. The next group are the 7 unlucky ones. They were all severe at the time of follow-up. I'm glad to say that my personal knowledge of them is many of those have subsequently improved, at least into the moderate degree. This one is very interesting. It is possible to have very mild ME and not to know it. I've just picked up 5 cases in a hospital where I'm working. They were all attending pediatricians, and none have been noticed to have ME. This boy had no reason to think he had ME, and he was operating at about 90% for 2 years. But during that time, every time he got a virus, which would keep someone off school for 1 day, he was kept off school for 1 month. And this was the warning sign. And I think it's not really, thank you, it's not really in the books, but undue susceptibility to virus infections is probably a diagnostic marker. Sorry, whoops. And then, because he didn't know he had ME, he went backpacking in Scotland with his father, carrying his tent, walking up and down mountains, with the result that he became severe. And that is why a good GP, a good family doctor who spots an early case of possible ME and can give warning advice can really influence the patient's future. You all know from bitter experience how much damage forced exercise can do. But I always remember a girl who was 90%, she was symptom-free, attending school, but not allowed to do sport. And the teachers coaxed her and tricked her against medical advice to do a cross-country race. And she did it, and she finished it. But she had an 18-month relapse, was off school for all that time. So early diagnosis and cautious advice can affect the future. I was talking with a social worker last week whose daughter was 14, and she was admitted to hospital for forced exercise, and she walked in and was carried out, and she is housebound and bedridden 30 years later. That's the damage that early pressure and exercise can do. So it is important. And this is the other group, the largest amount of in-between. But again, I know a lot of those made good recoveries. And look here, even one of the most severe ones, who was tube-fed for 3 years and bedridden, is now working for our post office and made a very good recovery. So it's very unpredictable. There are wide fluctuations in severity, sometimes spontaneous remissions, and then quite the commonest reason for a relapse is the virus infection. And we can be cautiously optimistic with children, but we shouldn't overestimate the value of what we've got to offer. Now, the biggest problem, that I've hinted that this is worse in the UK and in Denmark and other places than it is in Iceland, but it is frightening how after 3 government reports and the Institute of Medicine report, you still get doctors who talk like this. Family doctors who say, we don't believe in ME in this practice. One doctor rang a charity recently and said, I'm really worried, I think I've got ME. I said, oh yeah, why is that a problem? He said, you don't realize it's been a policy in our practice to treat all adult patients with ME with unremitting ridicule and rejection. And now I'm having to tell my partners that I've got this condition. I think I'm going to take early retirement and pretend it's on grounds of depression, because depression has less stigma than ME for those doctors. And that was a year ago in the UK. Children don't get ME. I've heard paediatricians say that. Ridiculous. He's too young to get ME. I saw this boy at the age of 9, threatened with care proceedings because the paediatrician had refused to diagnose it. Don't like labeling cases. Don't like making diagnoses for which you haven't got any treatment. But this is one of the best. This is from a professor of pediatrics to a 6-year-old girl. You can't have anything wrong with you because all your tests are normal. 6-year-old girl to professor. Maybe I've got a condition for which you haven't yet invented the right test. Game, set, and match to 6-year-old. And that professor edited a major book on pediatrics. And if you look in the index, ME doesn't exist. And chronic fatigue syndrome is in the section on child mental health. And this is chronic fatigue syndrome is the commonest psychosomatic disease in adolescence. So that's what we have to deal with. You've all heard of the famous psychiatrist in our country who 20 years ago ordered a 14-year-old boy with ME to be thrown into the hydrotherapy pool to prove that he was a fake. And he drowned, but they just saved him. But it's like the medieval test for witchcraft. So the children, I think, it's a very pure clinical situation when you see an 11-year-old boy who's very keen and loves football, who's struck down following a virus. You believe in it. You don't feel like being psychological. And I used to send questionnaires to my colleagues and say, how many of you think it's primarily physical illness and how many think it's primarily psychological? And I was very heartened that the general paediatricians, 19-7, said they thought it was primarily a physical illness. But then I sent the same questionnaire to all the child psychiatrists, and they refused to tick any boxes and wrote me long essays on how these questions are quite improper and hadn't I heard of the mind-body continuum. And for too long in the UK, psychiatry have made so much of the running, and of course saying that CBT is the answer keeps them with a foot in the door. But and it's very interesting to see how quiet the psychiatrists have gone about the work from Norway. It has been received with a deafening silence in the UK, apart from the organic doctors. How am I doing for time? Sorry. You okay? Yeah. I sometimes think that those that the God wishes to destroy, he first drives mad, and if they're doctors, he confronts them with ME. And if seeing an ordinary case of ME doesn't drive them mad, then he confronts them with a severe case of ME, and then they go mad. You all know the story of the boy in Australia who was a doctor's son. He developed ME and was taken around all the ME experts in Australia. And they said to him at the end of that year, you must have found out a lot seeing all these clever doctors. He said, not much. They don't understand it, but there's one thing I've noticed. ME is a condition which induces a psychological disturbance in doctors confronted with it. Out of the mouths of babes. And the doctor who's never seen a case of severe ME panics. He thinks the patient's going to die. He thinks he's missed something. He admits them to hospital and sticks a needle in them, makes them worse. And everyone panics. I panicked with my first one and sent them to a teaching hospital where she was very, very upset. And we've talked about the lack of efficacy of graded exercise or the harmfulness of graded exercise, but because the case is severe, the doctor feels he has to do something. And yet even our national guidelines said there's no evidence of efficacy of CBT and GET in severe ME, and there's not really that much evidence elsewhere. Some of you will be familiar with this picture, but a bedridden, prostrate, total body pain, hyperesthesia. The mother has to turn them gently in bed because it's so painful. But they're lying in a very darkened room. You sometimes have to come in with a little torch and to examine them. And then they have problems with, it's almost too tiring to eat, and they've lost their appetite, and they may need tube feeding. And some cases sleep too much early on and then have sleep reversal later on. Our best motto in medicine is to do no harm, and these patients are so ill. We've said how even mild cases can be damaged by force, and these severe ones need to be treated even more gently. We have an abbreviation TLC in the UK, which is tender loving care. Don't panic. Explain to the parents what you think it is. Keep your mind open about differential diagnoses. Try to avoid over-investigating. And above all, try to keep them at home and visit them at home rather than admitting that hospital is a terrible place for a severe ME patient. And the rest is just good medical and nursing care. And I often felt that tube feeding is best started soon, rather than having 6 months of the mother struggling to get fluids and waking them up and doing this. If you just tube feed, everyone can relax. And most people say, oh, I wish we'd done it sooner. Surprisingly, they never seem to get venous thromboses. They could get pressure sores, osteoporosis. And ideally, I used to have a community nurse who would come and see them, and they would develop a relationship and they'd be supportive. Of course, in some parts of the country, these patients never get seen. They stay at home. The doctors will not visit them. One doctor said, in our practice, we only visit for terminal illness and broken limbs. And don't involve too many others. I made all these mistakes. I get someone comes in, a health visitor comes in, and so they have a big meeting about it, and someone says, do you think the father could be sexually abusing her? Do you think that's the problem? So they wrote query sexual abuse and sent the minutes to the parents to upset them. I gave immunoglobulin to all my 6 severe cases, and they all made full recoveries. The actual evidence from randomized controlled trials is that immunoglobulin has shown greater efficacy than CBT and GET, and somehow it's been airbrushed out of history. Partly in the UK it was because of fears about mad cow disease, but you can get safe immunoglobulin from anyone. I know Dan was saying that you can give it if they've got low subgroup classes. I'm not sure that's necessarily the way it works. I mean, no one knows, but if only we hadn't given so much money to the psychiatrists, we should have done some more immunoglobulin trials. And I think it does tie in with the kind of work from Bergen about immunomodulatory treatments. No one's mentioned Lyme disease and atypical infections, but one of my patients did turn out to have proven Lyme disease that she'd caught in America, and that is a whole other controversy, but I think it's an increasing problem, and we can leave that for the discussion. So the severe ones were bedridden for more than 6 months, and most of them needed tube feeding, and 4 out of 7 made a complete recovery. I should mention the first one who got immunoglobulin, it was not given by me, it was given by a family doctor with a special interest, and he did it without my permission, and he cured my patient. And I was very grateful. And this boy went back to school after missing 2 years, and he became captain of rugby, head boy of school, and climbed the 3 highest mountains in the UK within 24 hours. He did have a car to take him between, but he did that, and he made 100% recovery. And if you were arguing with the psychiatrists, if you've got severe ME and it's a psychological disease, then you should surely be able to find some psychopathology. But these patients all came from absolutely normal families, and even though they were desperately ill, they were not clinically depressed. They said, I'm fed up, but I'm not depressed. And they kept their sense of humor. And I was impressed with how well they did. These very severe cases seemed to respond, and I think we should look again at immunoglobulin. These were some of the trials. It's another Peterson, isn't it? Is that you, Dan? It is. No effect. Oh, well. Yeah. But Kathy Rowe, a paediatrician in Australia who collaborated with us on the international consensus diagram, has got a double-blind, placebo-controlled trial in this and had a positive effect, and she uses a lot of it. This girl was my second severe case, and I think you'll accept she is totally recovered enough to be a bridesmaid. And she had 2 years of lying in severe pain in a darkened room, tube-fed, being nursed by her mother. But once she began to improve, she made a very, very good recovery. Now, getting back to the problem cases, we now have these special centres in the UK set up, usually run by psychiatrists, and we will give you our treatment. And we think it's so good that if the child doesn't get better, it's the parent's fault, or it's psychological. And if the parent says, thanks, but no thanks, we don't want your treatment, then they start calling the social workers in. But the bottom line I tell social workers is there's no form of treatment that is so effective that it can justify a coercive approach. This next patient is someone whose paediatrician was very confident that her treatment would work. The girl was 14 years old. She was the daughter of a nurse, and she was already severely ill, lying in a darkened room, and the paediatrician could not believe she was that photosensitive, and it was all the mother's fault. She applied to the High Court, to a very famous judge, and promised the judge that if she'd give her a court order just for 6 months, she'd admit her to hospital, give her vigorous physiotherapy, and would have her back at school by September. And the official solicitor, who's the guardian of children, like an ombudsman, approved, the court order was given, and she was admitted to hospital against her will and was subject to vigorous physiotherapy. After 3 months of torture, she said to the physiotherapist, "You're in breach of your own professional guidelines treating me like this." And the physiotherapist stopped. So she had 3 more months in hospital, desperately ill. Now, the judge and the official solicitor had to save face. They couldn't send her home, so they actually sent her to our place in Durham at the mother's request. And this is how she looks after 6 months in hospital under a court order. And if you want more evidence that physiotherapy does not cure you, that is enough. This is an even worse case with the same phenomenon, and it comes from Germany. And this was a 14-year-old girl with severe ME who I heard about, and someone asked me to go and give evidence, and I tried to reason with her doctors. And she was in hospital for 15 months. And the doctor agreed it was severe ME, but he was a neurologist, and he believed that his treatments for any neurological condition worked, and she needed an activation regime, which meant they woke her up, pulled her out of bed, put her in a chair, strapped her head to the chair because her head kept falling, wheeled her around the ward, made her talk to a psychiatrist, talk to a teacher. Every day she was subject to this. They finally lost patience and put her in, in gyms they have those vibrating things. They put her in a vibrating chair to stimulate her muscles. And this is what she looked like. She was nearly dead. I thought they were going to kill her. She could not turn herself in bed. She had to ring for the nurses. The nurses were told to disbelieve her. They'd say, "You lazy cow, you can turn yourself." She had 15 months of this physical and emotional abuse. And one of my I saw her twice in hospital, and I gave evidence to a German court, and a lovely lady judge heard me and restored the mother's parental rights, and we allowed home. And I think you will see that the light has come back into her eyes. So this is the kind of thing that is happening. There's a boy in Denmark now, after Karina Hansen, a 12-year-old boy in a psychiatric unit whose mother's had her rights removed. And I think it's terrible. But I've had similar cases in the UK that are still ongoing. Just like to finish with a mysterious question for future research. There was a man who wanted to cycle the length of Britain just for fun, but he wanted a charity, so he cycled from Land's End to John of Groat's, and he asked an ME charity if they would support him. So he raised £10,000 for ME, and he came to this celebration event and handed over this cheque for £10,000 to ME research. And on the way up, cycling up through Britain, this charity gave him ME families to stay with. And everywhere he stayed, he would meet a new one. And he said, as he presented the cheque, he said, "There's one thing I don't understand." He said, "I didn't know much about ME before I did this, but is it only a condition that affects nice people? Or can it affect anyone and it turns them nice? I don't know." Thank you.